This is the story about a community with heart and a tradition of healthcare described as remarkable for a city of its size. This is the story of Fairbanks Memorial Hospital, Denali Center, and Tanana Valley Clinic. It was 1903, a year after Felix Pedro discovered gold near Fox. Pioneers who had settled on the banks of the Chino River were eager to build a hospital. The Episcopalians responded first, and by 1904 had built St. Matthew's Hospital next to their church on First Avenue. But a gold rush was on, and Fairbanks was booming. The old hospital became woefully inadequate. Father Francis Monroe, a Catholic priest, made it his mission to build a new one. By Thanksgiving Day of 1906, Fairbanks had a new 30-bed hospital across the Chino River named St. Joseph's. Beginning in 1910, and for the next 58 years, St. Joe's was run by the Sisters of Charity of Providence, and they had their hands full. An ever-growing community, fueled by the wartime expansion of military aviation and construction of the railroad, called for a 20-bed expansion in 1935, and finally, a new concrete addition in 51.
In the old hospital, we had a little emergency room which was next door to surgery. It was just one room. We didn't have, all the people working that they have nowadays. And of course, we didn't have all the equipment that you had to learn and know about that they have now.
By 1960, St. Joseph's was beginning to show its age.
There was a concern amongst the Sisters of Providence themselves that they would have to have a new facility.
Despite their best efforts to raise funds, by the early 60s, the sisters realized they would have to abandon their plans to rebuild. In 1967, after voters had rejected 2 bond issues, it was clear they would soon have to close St. Joe's for good. On August 10, 1967, St. Joseph's fate was finally sealed when the Chino River began to rise. By the time it crested, the hospital and most of downtown was underwater.
Nobody thought that it would come up that fast. And I went home from work about 5 o'clock in the afternoon, and I never did go back because it came up in the night so fast that I couldn't get back there.
Fairbanks was a disaster. As the community rebuilt itself, a group of concerned citizens stepped forward and took on the task of building a new hospital. They formed the Greater Fairbanks Community Hospital Foundation in February of 1968 and asked William R. Wood, then president of the University of Alaska, to serve as the board's first president. In March, newsminer publisher Charles Snedden and local businessman Ron Nerlin agreed to co-chair a fund drive to construct a new hospital.
We started out to raise $1 million, which was a large sum of money to raise in a community that had fewer than 20,000 residents.
Whenever something like that happens, people just start pulling together again.
The one that I will always remember is a man by the name of Herb Growert. And Herb lived out at the end of Pear Road in an old log cabin. And here's a man that's, destitute. He's living in these conditions that are just unbelievable. And he wrote out a check for $1,000 to the hospital foundation.
And when things are tough in Fairbanks, Fairbanks gets tough.
In 1969, the foundation presented plans for a 4-story, 116-bed hospital, and the federal government committed $1.9 million for a section for Alaska Natives. Kiewit won the bid to construct, and in May 1970, there was a joyous groundbreaking.
Instead of having 2 or 3 dignitaries with shovels, we had, as I recall, about 150 people at a community effort groundbreaking.
Almost 2 years after breaking ground, the new hospital opened its doors.
When we opened the hospital in April of 1972, it was all paid for.
We were in the old hospital at one day, and we were fully functional over here. It was masterfully executed.
And it seemed so large to us, you know, because we were used to such a small place. It was almost like you wondered if you were going to get lost.
In the meantime, Lutheran Hospitals and Homes Society of America, known to date as Banner Health, agreed to operate the new hospital. The 70s saw an increased pace of development and construction in Fairbanks.
Pipeline was upon us, growth was upon us, and we've had to add to this hospital every year since we've been here.
Groundbreaking for the 70,000 square foot North Tower addition began in June 1976 and was dedicated 2 years later. In 1978, the hospital opened a badly needed intensive care unit with state-of-the-art equipment for acute care.
And the important thing is that all these bells and whistles don't mean anything unless you have people who are knowledgeable, who are a young staff, an aggressive staff, came from first-class training facilities. But as important, and maybe even more important, is we had the availability of nursing staff who were well-trained. That's the best of all worlds.
In the early 80s, a new women's center was built offering better obstetrical care for mothers about to deliver, and a well-equipped, well-staffed neonatal unit for babies born prematurely.
So babies that are born 30 weeks or greater from gestation generally stay here in the community so that the moms can come in anytime, night or day, to visit with the kids. We have all the equipment, respirators, monitors, and everything that we need to take care of these little tiny babies.
1985 saw the completion of a 5-story South Tower.
We didn't need that much space, but it was justified on the basis of the fact that once you're in the ground, that's the big cost. And from there on out, it is economical to have a shell that you can fill in.
But as the hospital was expanding its physical boundaries, it was also striving to expand the boundaries of technology.
And of course, we were very proud that we had a CAT scan. That's a big deal. I guess we could spend money every day of the year in improved equipment because that's how fast things change.
It's hard to keep pace. The number of new technologies, the number of new drugs, the number of new treatments. The MRI scan was probably one of the first equipment purchases in the 90s that was a big step. We went to the foundation, we said we have to have it. People decided that was the priority and they would buy it. We had to do it to keep step, to keep abreast of the changes.
In the 80s, community concern also turned to long-term care for the elderly at the Old Carriage North, later known as Denali Center.
Through the late 80s into the early 90s, Denali was losing over $750,000 a year. There were great questions on how to keep the doors open. There was a great sense of teamwork and compassion, but the physical structure itself was sad. There's no question about it. There was crowded rooms, crowded activity rooms, hallways were narrow and dimly lit.
Once again, the foundation turned to the community, and the Denali Center Fund Drive, spearheaded by Jeff Cook, took off in 1991.
One of the major things that contributed to us deciding to go ahead and build that facility.
And what we got is what you see today, probably one of the finest long-term care centers in the state. One that's enviable anywhere.
The atmosphere is conducive to health, it's conducive to comfort, and it's conducive to the kind of support that people need in nursing facilities. Right next door, we have the opportunity to share facilities, share expertise, make close contact, and it is beautiful. Just a delightful area that was well designed, well conceived, and again, brought into existence by that same group of people, you know, from the foundation.
One of the national trends has been to move from inpatient medicine to outpatient medicine.
Fairbanks embraced it with the new $11.4 million outpatient center in the mid-90s.
So building our outpatient center was, I think, one of the first examples of how we really all got together in the very early stages. The physicians, the nursing staff, the hospital administration started planning this thing way in advance.
The new century ushered in an intense period of growth.
You know, if you look at the last decade of progress at this hospital and the care we provide in Fairbanks and Interior Alaska, it's incredible. We've kept our debt low, we've kept our rates reasonable for the people here, and we've provided care that the people have had to go out of town or out of state for.
In 2000, the foundation, once again recognizing an unfulfilled need, opened the Cancer Treatment Center, the first accredited cancer care program in Alaska.
So the Cancer Treatment Center brings together medical oncology, radiation oncology, and the tumor registry, which is the ability to track and define those unique cancers to the interior. All these services, jointly related, are under one roof.
What we tend to do more and more now is combined therapy, oftentimes using chemotherapy with radiation therapy to make both work better.
Now people can stay in this community and they do not have to leave over the course of 6 weeks to communities like Seattle or Anchorage.
If you look at just the numbers in the community, we would have never built a cancer center, but it was the right thing to do.
Following the death of Dr. Michael Carroll in 2011, the Cancer Treatment Center was rededicated to him. In the early years of the decade, it became clear that a newer lab facility was needed.
In 2003, we built the East Tower Lab, which rivals the space of anything you would see in an academic medical center. So now we have more access, more room, and better technology.
And to improve the level of care, Fairbanks Memorial in 2003 began implementing computerized medical records throughout the hospital, putting them, once again, ahead of the curve nationally. In the following years, the hospital and foundation moved forward with plans for yet another new facility.
So in 2005, we built an imaging center that has won national recognition for its innovation and design.
The 57,000 square foot center is state-of-the-art and provides an array of imaging tools and technologies for early detection, examination, and diagnosis. And in 2011, the center also began offering 3D ultrasound, which gives a much more detailed and lifelike image of fetal development.
This imaging center is a great example of how you won't find a facility that rivals this in most communities this size.
As part of the Greater Fairbanks Community Hospital Foundation's long-range expansion and renovation initiative, construction began in 2006 to expand their emergency department, which opened a year later. It created drive-through ambulance bays, added 2 triage, 2 trauma, and 27 private treatment rooms, greatly enlarged the waiting room, and remodeled the inpatient imaging center for emergency and hospital inpatients. It now serves over 36,000 patients a year.
They've really made a commitment to be the best that it can possibly be. I think the renovation of the emergency department perfectly reflects the foundation's commitment to the community and building a hospital that exceeds the expectations to the size of the community.
In 2008, the Greater Fairbanks Community Hospital Foundation purchased the Tanana Valley Clinic for 2 primary reasons. The first and main reason was to serve more Medicare patients, which has been the trend at TVC since its purchase. And secondly, since more doctors today prefer to be employed in a clinic setting rather than owning their own practice, more physicians, including some key specialties, have been recruited to the community since the purchase. A win-win for everyone. In the past, one of the greatest challenges facing patients in Fairbanks had been access to immediate cardiac care.
Over a decade ago, we didn't have a heart center. We didn't have the care. We were medevacing or sending out over 400 patients a year for heart care out of the community where they were away from family and friends and support.
The Heart Center is a classic example of the entire community, the physicians, the board, the call from the community to come together to provide the highest possible quality cardiac care.
In 2010, the hospital opened a brand new heart center that provides expert care in the diagnosis, treatment, and prevention of heart disease.
Currently what we provide at the Harry and Sally Porter Heart Center is everything short of open heart surgery. There isn't anything you can find in a heart center across the country that isn't available here today.
That's what's so great about it. We're keeping people at home, giving them the service they need, and making life better for people.
We're saving lives. The bottom line is we're saving lives. So I think it's very appropriate that we name this heart center after Harry and Sally Porter. Two people with big hearts.
From its beginnings, Fairbanks Memorial Hospital has served the people of our community and forged partnerships within the community.
Bassett has a unique relationship with Fairbanks Memorial Hospital. Our physicians are credentialed at Fairbanks Memorial to see our patients at Fairbanks Memorial. Nowhere else in the country is this being done to the extent that it's being done. This means our patients are followed by our physicians and get quality care every time.
In the mid-90s, the foundation, recognizing the need to expand services to the Native community, once again partnered with the Tanana Chiefs Conference to broaden services and relocate their Chief Andrew Isaac Health Center within a larger part of the hospital.
One of the really wonderful aspects of the Native culture is the sharing, and we've been able to use their professionals and their providers and their labs, their radiology, and so it's just been like a hand-in-glove relationship.
More than 15 years later, the foundation helped Tanana Chiefs complete a land swap purchase, which paved the way in 2011 for the construction of a beautiful new facility adjacent to the hospital.
The partnership with FMH has been going on for a long time, and it still is today, and it's even grown stronger as we work with the foundation and Mike Powers specifically in realizing that we're going to move off-site and they're going to lose revenue, and still them being gracious enough to sell us the property that we needed to build our facility on. It speaks volumes to that relationship.
In 2011, the foundation reached out to further develop their relationship with Hospice of the Tanana Valley.
First partnership with the hospital was to build this building that we're in right now. The other really exciting partnership with the hospital is creating a first-class, comprehensive medical hospice program. That means that the hospital will be merging with hospice to provide not just volunteer support, but also doctors and nurses helping people to stay in their homes at the end of life.
Hospice is a great example of this vision of a continuum of care that was defined in 1972, and now it is possible for Fairbanks Memorial to take care of patients and the community from cradle to grave.
Convinced that there was a better way to treat chronic inebriates than sending them to a trauma hospital, Fairbanks Memorial partnered with the courts, business and Native communities, the city, and various social service providers to place chronic inebriates in a new enhanced detox facility, which was in part funded by the foundation.
Part of Fairbanks Memorial Hospital's responsibility is to be fully prepared for any emergency.
Should Alaska be cut off from the rest of the world, the hospital stands ready with enough fuel, food, water, and medical supplies to be self-sustaining for over a week. And every 2 years, Fairbanks Memorial Hospital joins federal, state, and local agencies in emergency preparedness training exercises. The goal is to ensure coordination in the event of a natural disaster, and that the hospital can handle the surge of casualties and be able to treat the injured.
We put thousands of hours into training and preparing for emergencies like this, and it's all worth it if we could just save one life.
I think Fairbanks Memorial has been an anchor for the community. I think it's been very important to the whole economic development of Fairbanks.
From both a clinical standpoint and a job standpoint, probably 10,000 employees have passed through these doors, have worked here in some capacity. And that's an incredible contribution to the economy of this community and the state.
We have a first-class hospital, 90+% board-certified physicians, which is unique in any hospital. And we provide every service except neurosurgery and open heart surgery. That's unusual for a place this size.
This hospital is unique because it's owned by the community through the foundation, and it's operated by Banner. And they have been rated as one of the top 10 in 2010 and one of the top 5 by Reuters in 2012.
Every
dollar that comes in is poured back in to these facilities and to this hospital.
The profits all stay here to give us quality care, new facilities like the Imaging Center, the Heart Center, the Cancer Center. It's the best of all worlds. There is not another community of this size in this country that has better facilities, better people, better care than Fairbanks. We are blessed.
You have a commitment to see that the place where you live is left a little better than you found it.
Because after all, we're taking care of our neighbors. We aren't taking care of somebody we're never going to see again. We're taking care of our neighbors.
It's that partnership. This is a we thing, this is us, this is ours, and that's where the magic is.
There isn't a soul that's involved with this hospital, foundation, administration, or medical staff, which doesn't have a keen feeling of having to be a faithful steward.